Extract 1. Questions 1 to 12. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you feeling today?
Hi, Dr. Woods. Unfortunately, I'm not feeling much better. In fact, I'd say things have gotten a little worse.
I see. Can you elaborate on how you're feeling worse?
My cough has become more productive, and I'm now coughing up green mucus. I also feel a bit more short of breath, especially when I climb the stairs.
Alright, those are important details, Mihiraa. I've reviewed your latest chest X-ray and blood tests. There are some changes we need to discuss.
What kind of changes, doctor?
Well, the X-ray shows that the pneumonia seems to be spreading slightly in your left lung. The blood test indicates elevated white blood cell count, which suggests your body is still fighting an infection.
Oh dear. So what does this all mean?
Based on the new information, it appears the initial antibiotic treatment for your aspiration pneumonia may not have been entirely effective. We need to adjust your treatment plan.
What are we going to do now?
First, we'll switch you to a different antibiotic with broader spectrum coverage. This will help us target a wider range of potential bacteria.
Is there anything else I can do besides medication?
Absolutely, Mihiraa. Staying hydrated is crucial to loosen mucus and make coughing easier. You can also try using a humidifier at night to help with congestion.
Those are good suggestions. How about natural remedies or therapies?
That's a good question, Mihiraa. While there's no substitute for your medications, steam inhalation with a little eucalyptus oil can definitely help loosen mucus and ease coughing.
Yes, that's a good idea. I have some in my home.
Okay. Additionally, practicing pursed lip breathing exercises can improve oxygen intake and reduce shortness of breath. I can show you these exercises before you leave today.
Thank you, that's really helpful. Is there anything else I need to do? Any further tests?
Yes, one more thing. Given the persistence of your symptoms and the pleural effusion, I'd like to schedule a CT scan of your chest for a more detailed picture. This might help us understand if there's an underlying cause for your aspiration pneumonia, like a swallowing issue.
Swallowing issue? Do you think that might be why I got pneumonia in the first place?
It's a possibility we need to explore. Sometimes, problems like dysphagia and difficulty swallowing can lead to aspiration, where food or fluids enter your lungs instead of your stomach.
Okay. I got it.
Mihiraa, the CT scan can help identify any structural abnormalities in your throat that might be causing this. Here's a referral for the CT scan.
Thank you, doctor.
I'd like to schedule you for a sputum culture to identify the specific bacteria causing the infection.
Okay, no problem.
We will schedule it for next week. In the meantime, continue taking your antibiotics as prescribed, start the corticosteroids, and try the breathing techniques I'll show you. Mihiraa, if your symptoms worsen or you experience new ones, don't hesitate to come back immediately.
Extract 2. Questions 13 to 24. You hear an orthopedician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. What brings you in today?
Hello, Dr. Macroni. Thank you for taking the time to see me today. I'm experiencing significant pain in my right knee recently, and it's been quite bothersome.
I see. Can you tell me a little more about the pain? When did it start?
It began about 6 months ago. It's mostly a dull ache, especially in the morning when I get out of bed. Sometimes, it flares up if I'm on my feet for too long.
Interesting. Do you have any difficulty with daily activities like climbing stairs or squatting?
Yes, actually. Stairs are a bit of a challenge lately, and I can't seem to kneel down in the garden anymore. It's quite frustrating because I used to go to the local hiking club every weekend.
Have you noticed any swelling or grinding sensation in the joint Mihiraa?
There isn't much swelling, but sometimes it does feel a bit stiff and makes a clicking sound when I bend it.
Have you tried anything to manage the pain? Over-the-counter medications, perhaps?
I've been using Aspercreme, a topical analgesic cream, but it doesn't seem to do much. I also tried applying heat and soaking in warm salt baths, but the relief was very temporary.
Mihiraa, does anyone in your family have a history of knee problems or arthritis?
Well, my father did have some issues with his knee when he was older, but I don't know the specifics.
Thank you for the information, Mihiraa. Based on your description, there's a chance you could have osteoarthritis of the knee. To confirm this, we might need an X-ray to visualize the joint structure, and possibly an MRI scan for a more detailed look at the soft tissues.
Huh. Sounds serious. What kind of treatment options are we looking at?
Don't worry, osteoarthritis is a manageable condition. We can explore several options. First, we can focus on non-pharmacological interventions like physical therapy, to improve your joint mobility, and strengthen the muscles around your knee. This will help reduce pain and improve your daily functioning.
Physical therapy sounds good. I'd like to try non-surgical options first. Is there anything else I can do on my own?
Absolutely, Mihiraa. Maintaining a healthy weight can significantly reduce stress on your knee joint. Additionally, regular low-impact exercises like swimming or cycling can improve flexibility and overall well-being.
I'm happy to try those things.
Excellent. We'll discuss the results of your tests and finalize a treatment plan at your next appointment. In the meantime, I'll prescribe a stronger pain medication, tapentadol, to help manage the discomfort.
Thank you, Dr. Macroni. I appreciate you explaining everything so clearly.
You're welcome, Mihiraa. We'll discuss the treatment options in more detail once we have the X-ray results. Depending on the severity, we may consider injections, or even a total knee replacement surgery in the future.
That sounds very serious.
That is the end of Part A. Now check the answers.